of the city's big unions is trying to put pressure on the healthcare industry to get costs under control. 32BJ is hosting a conference today called Changing the Playbook on Hospital Prices. The union represents tens of thousands of property service workers and says something needs to be done to address the ballooning costs of healthcare. The keynote speaker at the conference is Mark Cuban. The outspoken businessman has already stepped into this debate with his cost-plus pharmacy business, which cuts out the middleman and tries to bring more affordable prescription drugs to people, whether they have insurance or not. Mark Cuban is at that conference now in Chelsea. Mark, good morning. Thanks for spending some time with us.
Thanks for having me on, Pat.
You got a lot going on. Why did you choose to get involved in this?
I mean, nobody likes how they pay for their health care. Nobody knows the cost of their medications. Nobody knows what it's going to cost if they have to, God forbid, go to the hospital. And I think it's time we really have full, complete transparency. And that's why we started costplusdrugs.com. When you go to costplusdrugs.com, we uniquely actually show you our cost. Then we show you that we only have a 15% markup, so that when you check out, you know you're paying less for your medications than anywhere else, and you know what you're paying for them. And that's one of the reasons I came here to 32BJ and what they're doing. They're working hard to bring transparency, not just to medications, but throughout hospital costs, all of healthcare. And that's important for businesses, I mean, that provide insurance for their employees, or unions that provide insurance for their employees. Nobody, whether it's the business, the CEO, the head of the union, nobody knows what they're paying right now, and that's what we're trying to change.
So just coincidentally, I was with my dad last week, and he's undergoing some treatment, and the hospital said you should check out Cost Plus, and we did. But I'm thinking of the one test. They had him walk from one side to the other to do some tests, and he was self-paying. They would have billed the insurance company $750, but instead they charged $130. Like it's all just such a mystery.
Isn't that crazy?
Yeah.
Yeah, I mean, think about it, Pat, and I hope your dad gets better. But think about it. The biggest insurance companies in the world negotiate higher prices than any of us walking in off the street with a credit card. And that's something for everybody to be aware of. You know, before you go to the doctors, before you go to the hospitals, talk to your employer, your union, whoever it may be, if they provide your insurance, and ask them, is it better for me to walk in and ask for the cash pay price, and will you reimburse me? Because you're right, just like your experience, that's what everybody will experience. It's cheaper to pay with a credit card or with cash than it is to go through your insurance, because what happens is the insurance companies, or these middlemen called pharmacy benefit managers, they literally will jack up the price that they charge your employer just so they can make a spread on the pricing of the drug, and the insurance companies do the same thing on your healthcare.
So we see so many people with so many frustrating stories about the fight with the insurance companies, the hospital bill they never thought was going to be so high. But Mark, the system is so entrenched, and even with somebody like you making a speech today and trying to make some changes, there are a lot of things that have to change for this to get better. Where do we start?
So that's a great question. I mean, obviously it starts with our legislators, our politicians, and I think the focus has to change from thinking that health insurance is a proxy for care. It's not. What's crazy to me is somebody who has a horrific accident, goes to the hospital, and can't afford their deductible may not be able to get care. But if that same person wants a loan for college, wants a loan for a small business, wants to have their mortgage guaranteed, taxpayers will do that. I think it's time we focus on taxpayers helping people with their deductibles and their out-of-pocket costs, whether that means guaranteeing it, or for people who are beyond Medicaid and or in ACA programs or employer-based programs, having programs that help them pay for the actual out-of-pocket costs of their care, with limits on how much they pay the healthcare providers. Because now, with Medicare, there is a limit what we'll pay. For Medicaid, there's a limit what we'll pay. I think I think we need to change the conversation from focusing on funneling money to health insurance companies to helping people, patients, pay their bills.
Do you think that your work is being criticized within the healthcare industry? Is this message something that they don't want to see?
Oh yeah, the middlemen hate us. Like there's certain drugs that we can't carry, and it's not because we don't want to carry them at Cost Plus Drugs, but what happens is these middlemen called PBMs, they go and tell some brand manufacturers that if you work with costplusdrugs.com, we will remove you from our formularies and make it harder for you to reach patients. That's wrong, but that just, to your point, tells you how much they hate us and how much they're trying to slow us down. And we haven't really even started on the healthcare side. We're coming out with something called Cost Plus Wellness before the end of the year, costpluswellness.com. And what we're going to do is negotiate direct contracts with hospitals and doctors and clinics. And not only are we going to be transparent about the pricing, but we're going to publish the actual contracts that we negotiated, so anybody in the state of New York or anywhere across the country can use our contracts for their health care for their employees or for themselves.
Shaking it up a little bit. Mark Cuban, we appreciate your time with us this morning. Thank you.
Thanks, Pat. Hope your dad is doing well.
Yeah, you bet. He's doing okay. Thanks for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest news and weather updates every 10 minutes and more. We'll see you then.